Hello and welcome to another exciting edition of your program of choice, Health Affair on AIT. It is a platform where we focus on everything that concerns your health and the challenges of women and children with a view to finding lasting solutions. I am your regular anchor, Oshuomowa Daniels. In the last few days, there's been a spike in COVID-19 cases recorded across Nigeria. A new variant has also been reported. Some people have been asking questions as to whether it is necessary to submit COVID-19 test result before traveling after the complete vaccination. Yes, you do need the test result because vaccination does not prevent a person from contracting the virus. It only minimizes the chances of complications and dying from COVID-19 virus. Let's take you through our new segment before we continue the COVID-19 discussion and situation.
The Lagos State government has promised to heighten health interventions for children, adolescents, and mothers in the state, especially those in riverine and hard-to-reach communities. Speaking at a news briefing to commence the 2021 Maternal and Child Week celebrations, Commissioner for Health Professor Akin Abayomi noted that eliminating delays associated with necessary health care services was critical to reducing maternal and child mortality.
Around 512 women lose their lives. 512 women out of 100,000 women will lose their lives in an attempt to give birth to their children. We also know that we have about 59 of every 1,000 live births do not reach their 5th year of life. We also know that there's an infant mortality of about 49 per 1,000 cases. The solutions to this are to strengthen the health systems and to promote public health programs and to give access to our mothers while they're pregnant, and of course to ensure that they have the opportunity for good antenatal care and for the expertise that is required for us to identify high-risk pregnancies and to monitor the children the mothers during this period. But the Ministry of Health, under the leadership of Mr. Governor, is putting an emphasis on hard-to-reach areas for this year and next year. We're trying to create communication to these hard-to-reach areas through some ingenious means of solar and other kinds of satellite communication. We're also trying to develop ambulance services that can go on water and get to these areas, maybe increase our outreach clinics to these rural and hard-to-reach areas. And where there are emergencies, these emergencies need to be communicated to us, and there needs to be a means of transporting women who are in trouble in these areas or children who are in trouble in these areas. Either we need to reach out to them or we need to bring them from a hard-to-reach area to a more central location for more advanced and specialist care. Of course, very importantly, we will be spending a lot of time talking around family planning and child spacing.
The week-long celebration is to commence on Monday, July 12th to 16th of July with a target to carry out routine immunization, vitamin A supplementation, deworming of children between the ages of 12 to 59 months, HIV and tuberculosis screening.
These interventions are geared towards the welfare of mothers and their children. We have implementation posts at 310 locations, which are permanent posts, and we have about 376 temporary posts, and we have 752 mobile posts that will be moving around Lagos, carrying out these awareness activities and handing out treatments that are necessary for mothers and their children.
And these are essentially free to the mothers and the kids when they get to the healthcare facilities. And so the primary healthcare facilities will be playing a very pivotal role in all of this, and especially after this week that we are expecting a surge in the number of people that will be coming to the healthcare facilities to access care.
The vitamin A programs and all the other programs that are going on as prevention programs, starting from our PHCs and the nutrition assessments and nutritional supplement programs that try and prevent malnutrition, which is a common cause of illness because it affects your immunity, and then the baby then succumbs to a lot of other illnesses. So like I said, it's a very holistic approach to the child.
Maternal and Child Week ensures access to simple low-cost interventions for the promotion, prevention, and treatment of the common causes of maternal, newborn, and adolescent morbidity and mortality. The National Agency for Food and Drug Administration and Control, Nafdac, Director General, Professor Mojisola Adeyeye, has warned Nigerians via a public alert titled Recall of Any Sanitizer by Debar Nutritional due to the presence of methanol. Adeyeye stated that methanol or wood alcohol is a substance that can be toxic when absorbed through the skin or ingested, which can be life-threatening. She added that substantial methanol exposure can result in nausea, vomiting, headache, permanent damage to the nervous system, or death. The World Health Organization has disclosed the multi-agency report estimates of the global population up to 811 million people were undernourished last year. The report is jointly published by the Food and Agriculture Organization of the United Nations. It was said that the pandemic has triggered brutal recessions and jeopardized access to food, and yet even before the pandemic, hunger was spreading. This was all the more so in nations affected by conflict, climate extremes, and other economic downturns, and which is still battling high inequality. Report has identified these as major drivers of food insecurity. As outlined in the last year's report, transforming food system is essential to achieving food security, improve nutrition, and put healthy diets within reach of all. They encourage that planting of biofortified crops will make it easier for fruit and vegetable growers to access markets and tackling poverty. Test positivity rates of COVID-19 in Lagos has moved from 1.1% to 6.6% within the last 2 weeks. This was disclosed by the Governor of Lagos State, Babajide Sanwo-Olu, in a press release where he noted an increase in the test positivity rate from the end of June 2021 to the 8th of July 2021, bringing the total number of confirmed cases to 60,202 persons as of 11th of July 2021. Sanwo-Olu also indicated a rise in the occupancy rate at the isolation centers from an average of 1% to 6%. While encouraging Lagosians to desist from patronizing non-accredited COVID-19 treatment centers, he advised them to communicate all suspected and confirmed cases to only accredited health centers for the management and treatment of the virus. The governor equally reassured Lagosians that the government would explore all necessary avenues to increase access to vaccination, as those who have received the 2 doses of the vaccine are just about 1% of the population. He promised that all necessary efforts will be made to effectively mitigate the third wave of the pandemic in the state.
The usual hand washing and other hygiene practices have fast disappeared in most workplaces, except for a very few like this. Group gatherings have since returned, and commercial drivers doing their thing their own way. A situation many say calls for concern, given the virulent nature of the Delta variant.
Many people that have been coming into Lagos have tried to beat these regulations and these guidelines. And as you know, the federal government as well as the Lagos state government is not taking this matter lightly.
There seems to have been fatigue that have set in. Wearing those masks all day long is not an easy task. Social distancing when people have economic and social activities to do is also like a restriction. But for the sake of our lives, I think we should continue to do what is necessary.
There's still a lot of people that don't even believe that still there's anything COVID-19. And a few that believe don't believe, or they feel it's inconveniencing for them to obey the rules. And then the way it comes again, because it does not come like the former ones, this particular mutant, they go straight into the lungs. So by the time the person is hit that, he's already infected with COVID, it goes through a very rapid phase and the person dies.
Beyond the mitigating strategies, experts are calling for more vaccination uptake and sincerity of purpose by the federal government in the management of the pandemic.
And the federal government should make concerted efforts to see how the vaccine can be made available to Nigerians, because we don't want to witness the death surge among Nigerians.
Advice to other governors of other states they should take it serious. The Lagos State governor has just made this proclamation, so let other governors take that same step to put in place all the necessary measures.
Since the outbreak of the coronavirus pandemic in Nigeria, over 168,452 confirmed positive cases and 2,124 deaths have been reported.
Medical doctor, and I had the knowledge of medicine, and eventually I entered into the practical and the reality of the fibroids, and it was really challenging because I had to resign from my job the same year I was diagnosed, and I was bleeding heavily. It wasn't funny. In fact, in 2017 I bled every day that year. However, I thank God for the experience, because with this experience now, my knowledge of medicine, I'm ready and set to go into research to bring out solutions to what is happening now.
It has been hectic. In fact, it has been very, very difficult for me. I was actually diagnosed of the fibroid in year 2018, and ever since then it has been trouble, because I was actually scared of open surgery. I never wanted something like, me getting my stomach torn and all those complications. So I opted for supplements, and although there were some kind of significant benefit, but then at the end of the day, the fiber was not really dealt with.
Dr. Joy Oluwatobi and Patricia Omoke are alive and lucky to tell their stories about the challenges of uterine fibroids. Not many women are this fortunate, as some have died in the process or through complications from surgical intervention. With the introduction of high-intensity focused ultrasound technology, the challenges associated with fibroid-related issues will now be reduced to the barest minimum.
The Fibroid Care Center is a response to the yearnings of a teeming population of women suffering from uterine fibroids. This very common condition, as we all know, has greatly impacted on the quality of life of many women, resulting in the loss of man hours, impact on their homes, careers, jobs, and relationships across all spheres of life. These fibroids have contributed to their inability to conceive babies by affecting their fertility and its attendant challenges emotionally and psychologically. Now, you may want to ask, what is the correlation between my discussion about fibroids and giving Nigerians a positive story? Firstly, the Fibroid Care Center is a specialist healthcare facility focused on giving Nigerian women best-in-class, minimally and non-invasive solutions to their fibroid challenges. For women suffering from fibroids, majority of them are scared of open surgery. That has hitherto been the main option in taking care of their fibroids. Today, Nigerians have a choice of various endoscopic services or pinhole surgeries, as they are commonly referred to, or this new age non-invasive solution using high-intensity focused ultrasound, HIFU. This procedure uses ultrasound rays to literally burn off the fibroids without any invasive method. So the patient actually, in other words, is that you are not touching the patient at all. Patients can walk in, have the procedure done, and in a few hours return to their normal lives. You may want to ask again, how is that something to spin a positive story for our country? Nigeria, by virtue of this new technological acquisition, has joined a unique league of 29 countries in the world where this feat is possible. HIFU is a scientific breakthrough available right now, Nigeria being the 29th country, and about 350 centers globally. On the African continent, this is the third machine in Africa. South Africa has one, Egypt has one, and then we in Nigeria, we have one. It is significant to note that Lagos State, by virtue of this center, becomes the first host to a HIFU facility on the West African sub-region, thereby putting Lagos on the HIFU map. When we conceived this project, we had only one thing on our mind: seeing women live more fulfilled lives despite their fibroid challenges. To ensure that we bring this dream to reality, we decided to give 3 lucky women free treatment. And I believe one of them will be sharing her story with you today. Let me tell you that up to now, we've treated 3 women. And we have, from next week, we really have our hands filled with quite a number of women who are already lined up.
This technology, is fully named is high intensity focused ultrasound. It is use the ultrasound for treatment to treat all kinds of solid tumors. And here, this technique will be used for the non-invasive treatment of fibroid and adenomyosis. And maybe in the future, Dr. Ajayi will push this margin to the treatment of liver tumor, pancreatic tumor, because we are doing this using the same technique in Cairo, in Egypt, in Bonn University in Germany, and also in Oxford University in UK.
What I feel about the treatment is excitement, pure excitement, and a good thing to our generation.
When I lie down on the machine, practically within a many minutes, I just slept off. I woke up asking them, I hope you've done what I came here for. And also the rest has been done, and that was all. I paid for my surgery, and it's worth every dime. Even if you can't afford it, you could talk to 1 or 2 people. There are NGOs that can come to your rescue, and it's worth it.
Beyond the ease of the new treatment method, experts say to cut down on medical tourism.
World-class facility that will help to significantly reduce medical tourism outside Nigeria, thereby contributing to the growth and development of our national economy. As a member of the medical family, I appreciate the quantum leap the Fibroid Care Center will provide to us as a state and as a country.
I think this is an innovation. It's something new, and it's important in anything new, especially as concerning healthcare, which is one of the themes agenda of the governor, that all knowledge, this knowledge that has been brought in, is also shared locally, and therefore the healthcare workers here have the ability to operate this machine and perform this surgery.
It's not for every woman, so we need to select the women that can benefit from HIFU, and that's really the main job that we do, trying to select the people who can benefit from HIFU. So that's the main job that we do.
Why is it not for every woman?
There is no procedure that is for everybody. So the first thing is that when you are too obese, because like I said, we have to set the machine at a particular radius. If you are too obese, the ultrasound might not be able to get to where we want it to get to. So obesity is probably the only major contraindication for it. Then if you had a previous surgery, especially when it's what we call a vertical incision, a midline incision, we need to be very careful because of the chances that your intestine might be plastered to the wall of the abdomen, which is the intestine needs to be able to move when we're doing the procedure. So we can take it off the route that the ultrasound will travel. Okay. So that we need to do select such people who have done midline incisions to see that they don't, the intestine is not plastered to the wall of the abdomen for such people. And then for people who have done transverse, the bikini incision is very safe for them. Then we also look at people who have done liposuction or tummy tuck. They are no with us, because that also, what the most important thing that we are afraid of is injury to the bowel, and that's why the most important preparation before the procedure is to make sure that your bowel is empty. We give you a process for emptying the bowel. So you prepare your bowel just like you want to do bowel surgery. We prepare the bowel, and that's it. Once that is done, we're good. What it does really is simple. It converts ultrasound energy to burn wherever you target it at. And the good thing is that it's very you need to target it at where to burn. So, and if wherever you have not targeted it doesn't burn it. So, and that's why it's a safe thing. So that's how it works. So what we do essentially is burn off the fibroids. The woman just essentially lies on the table, and after about 1.5 hours, 2 hours, the thing is over. And you see most of them asking, well, have you started? Because you don't touch them. So it's the water from the machine that touches their abdomen, and then that's it.
Welcome back. Many people have thrown caution to the wind about the COVID-19 preventive guidelines. But I tell you today that the COVID-19 pandemic is not over yet. Nigeria has joined the list of countries across the globe where the new variant has been reported. To curtail the spread of the new variant, I took up the Lagos Commissioner for Health, Professor Akin Abayomi, on the mitigating strategies at an event recently.
We have set up what we call a third wave prevention strategy committee. As you know, the federal government has designated 4 countries as red listed countries. That is India, Brazil, Turkey, and South Africa, which means that anybody coming in from these countries into Lagos has to undergo 7 days of mandatory isolation in a government designated facility. They will also have an additional test, COVID test, one immediately on arrival and the standard one on day 7. The reason for the immediate test is so that we can minimize the exposure of these travelers to anybody, and also to give us the opportunity to identify what type of strains are coming into Lagos. And that's what we describe as genomic intelligence. It is important that we have a clear understanding of which of these COVID-19 new strains are trying to enter our community. By enforcing this mandatory 7-day isolation at a designated facility, it is a very important way of interrupting the opportunity for the virus to spread to members of the family of that travelers, and then from the family members to their colleagues at work or who they interact with socially. So this 7 days mandatory isolation has given us the opportunity to find a significant number of positive travelers into Lagos, and by confining them to 7 days isolation in this facility until they clear the virus has been a very important step in the opportunity for Lagos to prevent or to slow down the advent of a third wave. Many people that have been coming into Lagos have tried to beat these regulations and these guidelines, and as you know, the federal government as well as the Lagos state government is not taking this matter lightly. The Ministry of Justice in Lagos State, as well as the Presidential Steering Committee on COVID-19, has stated very clearly that anybody who tries to bypass these regulations will have their passports deactivated, and they will face sanctions when they are brought to the attention of the law enforcement agencies. We have a number of people that we've published in the newspapers who need to present themselves to the Lagos State government and explain why they have chosen to beat the guidelines or try to escape by not complying with the guidelines. And we are in the process of applying sanctions to many people and to deactivating passports. If you are not a Nigerian and you're part of this list, you will have your visitor's permit revoked or your work permit revoked, and the federal government is in the process of deporting visitors to Nigeria who are trying to bypass these regulations that have been clearly stipulated by the federal government. We are expecting a large number of children returning from Europe for the summer vacation. We know that the mutant strains are circulating in Europe, and therefore these sanctions are very important. The schools are important also. We have got heightened surveillance around our schools to make sure that when there are symptoms of COVID-like illness, that these children are quickly tested and their family members are tested, and this activity is ongoing as we speak. This is important to make sure that we interrupt the opportunity for the virus to spread within the schools and also for children to take the virus home and infect their family members or their parents who may be more vulnerable to the virus than the younger age group. This activity is very active at the moment, and we are trying to make sure that we are on top of any situation that is happening at any of the schools, whether they are day schools or boarding schools. It is important to recognize that there are multiple causes of COVID-like symptoms. Not every cough or cold or fever is COVID. So it's important that we don't stigmatize people, but that we are able to go into the schools very quickly, identify what is what, do quick tests, and identify those that are indeed COVID positive, and then have them isolated and do the contact tracing at home. This has been very successful so far. We've been able to pick up 1 or 2 situations and interrupt the opportunities for transmission. We are also still keen that public gatherings are controlled and conducted according to the guidelines, but we certainly hope that it will not be a severe third wave and that we will be able to flatten the curve as we have done both in the first and the second wave. There's nothing unique about Lagos or Nigeria. Every other country is going through the same experience, and therefore it is important that we are aggressive about minimizing the impact in Lagos State so that we can keep the economy rolling. Mr. Governor is very, very determined to make sure that we do not experience anything significant that will curtail the activities of the Lagos State economy moving forward.
Whilst everybody is getting tired, as it may seem, but it's not time to get tired, that they should continue to practice all the preventive methods. They should wash their hands, they should wear their masks, they should stand apart from other people when they're trying to talk as much as possible. And this may also be time to reduce the amount of movement and social activities that you want to attend. The Delta variant, as has been reported, is here. And for those who are monitoring the numbers too, you can see that the numbers are slowly starting to climb. So it's important that we all be cautious about what we're doing. Well, the first round of vaccinations has just ended a couple of days ago, but I would want to encourage people that once the next batch of vaccines are in, that as many people as possible should go and receive their vaccines. The reports we're getting from countries, especially countries who have vaccinated a large number of their population, is that even though they're seeing this Delta variant, it's not as serious in its effects as it was previously because a lot of people have received their vaccines. So vaccines are protecting, vaccines are doing exactly what they were designed to do. So people should go out and take their vaccines when they become available.
Just joining us, it's Etafe on AIT. Next on the program is our nutrition segment. Let's go there.
Cocoyam, also known as Colocasia esculenta, is a plant belonging to the Araceae family and are grown primarily for their edible roots, although all parts of the plants are edible. Cocoyam are cultivated as food crops. They are generally composed of large spherical cones from which a few large leaves emerge. Cocoyam is undoubtedly an important food crop across many countries in Asia, the Pacific, and sub-Saharan Africa, including Nigeria, Ghana, and Cameroon. It is the third important staple tuber crop after yam and cassava because it provides a cheaper substitute to yam, especially during periods of food scarcity. Cocoyam is most commonly grown for its edible roots and can be consumed after boiling, frying, or roasting. The flesh can be dried and used to make flour or sliced and fried to make chips. The leaves of the plant are also edible and are usually consumed as vegetable after cooking in dishes such as stew. They can also be baked and steamed. Because of the popularity of cocoyam in sub-Saharan Africa, it is estimated that West African countries alone consume not less than 4 million tons of cocoyam on an annual basis. This also indicates the production trends in terms of value and tons, as Nigeria leads other countries with a total annual output of 3.2 million tons in 2017. Cocoyam, popularly called Nigeria giant crop because it has better nutritional qualities when compared with other roots and tuber crops such as cassava and yam. It has higher level of digestive starch, dietary minerals including iron, copper, magnesium, calcium, potassium, phosphorus, zinc, and vitamins such as vitamin A, vitamin C, thiamine, and higher level of proteins.
Our clinical segment is insightful. We bring health consultation and diagnosis closer to you.
Symptoms of cancer generally are non-specific, and they are particularly related to the area of where the cancer is developing. So if a woman has breast cancer, we'll be looking at a breast lump, swelling in the breast. If it's cervical cancer, we'll be worried about things around that area of the woman's body, which is in the private parts. And we would not want to stress on the symptoms, because by the time women are noticing these symptoms, it is too late. That's why the focus is on prevention. Before the symptoms start appearing, women should turn up and do screening. Let us, the doctors, the nurses, pick up the signs, the issues that may be going on in that person's body, whether it's the breast or the cervix, before the patient starts feeling the symptoms. But for academic purposes, people ask what are the symptoms of cervical cancer. I can reel them off on my fingers. One is a discharge that is not going away. Bleeding. Women are supposed to bleed periodically. That's why we call it period. But if it's no longer periodic, bleeding every day, everywhere, anywhere, it is not acceptable. Bleeding after intercourse. Women are not supposed to bleed after intercourse. We call it postcoital bleeding. It's a sign of cervical cancer that there's a problem. Women bleeding after menopause. When women finish their period, they reach a stage called menopause, the end of periods. But women start bleeding again after they've already said bye-bye to period. That's called postmenopausal bleeding. When the cancer has now advanced away from the cervix area, it can now start affecting the pipes, draining urine from the kidneys and cause total blockage of urine passage. That is the final stage, and that is not acceptable.
Your opinion is relevant to improve the nation's healthcare system and human lives in general. This is why we give you a voice in our perception segment.
Use the mind of people. When you look at what is going on, the issue of COVID, whether it's existing or not, take the vaccine or don't take the vaccine. The issue is that, as a friend or a professor once said, he would rather take the vaccine and die by taking it rather than not take and die. Because the science that has developed the vaccine is worldwide. When you say they want to kill some set of people, will they want to kill the whole world? No.
This is the much you can bring you this week on the program. Please join us same time next week for another exciting edition of the show. My name is Oshuomowa Danes. Please make regular health checkup and habit. It is life-saving.